If you've been dealing with neck pain, mid-back pain, lower back pain, have you ever considered it could be the posture that you're missing out on that's causing the pain that you're suffering from? For today, we are going to go over 3 posture habits that you should consider. And before I talk about these habits, I also talk about spinal regions and curvatures to give you a better understanding. So for each posture habits, I'll also go over exercises and stretches that you can incorporate into your daily regimen. Hi everyone, my name is Dr. Leo, and I'm a chiropractor and clinic owner at Precision Performance and Wellness, and I've also helped thousands of my clients to help relieve for their lower back pain. Stay tuned. Let's first talk about spinal regions and spinal curves. So for our spine, there are 4 regions of them. There's cervical, which is the neck area. If we look at the spine model here, this is situated to the back of our head here. So this is our cervical region. The second part is our thoracic mid-back, which is right around here. And then the lumbar, which is your lower back region, this area. And then the coccyx and sacrum, which is commonly referred to as the tailbone, which is right here. So I'm going to talk about the curvatures now. So for the spinal curvatures, let's look at the whiteboard here. So first, let's situate ourselves. So I'm facing this direction, and that's exactly where the spine model is facing at, this way. So for the cervical spine, we have lordosis, which is our concavity. Thoracic spine, which is convexity, which is a kyphosis. And then lumbar spine, concavity, and then that's our lordosis. And then coccyx and sacrum area, we have a kyphosis, which is our convexity. Now, you probably notice there's a red line and ask, what is that line about? So that line is referred to as gravitational line. So if we draw a line straight down the spine diagram here, that indicates how the body is loaded, straight up to down. Ideally, that's how the weight should be distributed. Consider this. If there's a posture shift, such as slouching, such as our neck is jutted forward, then this area, the curvatures will be accentuated one way or the other, thus lead to pressure on the joints and also tension on the neck. And I'll further illustrate on each habit points as you should consider. So let's look at here. What happens if you slouch? So if you slouch, commonly what it looks like is shoulder roll forward, and then that will accentuate our kyphosis. Take a look at here. If we have rounded shoulder, this is actually increases that shift to the convexity. So that means the pressure will increase this direction. So for people that come in with mid-back pain, and commonly I see it with office worker, could be chef, could be contractor, because they often have to bend forward. And what they report is pain in their mid-back, this region. And look at what happened here. If there's any increase of pressure in this region, there's also increased pressure in the neck and also increased pressure in the lower back. So when someone that has a rounded posture, all 3 regions can be affected, but primarily is the mid-back region that's taking a toll on. So what should you do if you have to sit for long periods of time? I've demonstrated some exercise in the video. If you check out the channel, you can refer them as shoulder retractions and also reposition. These exercises are great to help bring some blood flow to the mid-back region so that you don't feel the stiffness around that area. Let's move on to the second point. For the second point is, again, this is referred to people that sitting with cross-legged, right? So one leg over the top. As someone who sits cross-legged, right over left side, what happens is their pelvis is rolled forward. And I'll demonstrate you on the diagram here. If someone that sits cross-legged, that means this area will be bow forward this way. And that means there will be increased pressure in this region. Now what happens is when someone that comes in with a pain around that, they point to one side off the center, then I'll ask them, this posture consideration is, do you cross your legs? And I would say 6 to 7 out of 10, they say they do. And what's remarkable is once I point out this habit with them and tell them to change it, and within 3 to 4 sessions, the pain intensity started to come down, and also the recurrence of that back pain started to come down. So you should definitely consider this. If you have ongoing back pain, stop crossing your legs. You might find it helpful. Now, what should you do if you do cross your legs? So there are exercises that I demonstrate in my channel. It's called bird dog. And what bird dog exercise does is it to help find that neutral sacrum position where you should be in so that there will be no pressure acting upon that region. So let's consider the third posture that you should watch out for. I think that by far everybody should take note of if they have ongoing lower back pain, and that is sinking into a couch. The comfortable couch, the expensive couch that we often get home, the first thing that we want to do is relax. But it is this maneuver that people do find trouble. Often when we sit in the couch, we spend hours on that position. And let me demonstrate what that does to the lumbar spine here. So what happens as we sink in? Our lower back started to sag and sink into the cushion, into this direction. Our lumbar spine should be a nice lordosis here. But as we sink into the couch, take a look at here. It creates that oval C shape, which increases the displacement of where it should be to where it is at now. Now, this is a lot of pressure acting upon the spinal region in your lower back. A lot of people runs into issue is when either their spouse asks them to pick up stuff from suddenly and they jump up from the couch and they feel a pull and sharp pain in their lower back. And this is because your tissue is being stretched, and that sudden change in directions causes that spasm in the lower back. I'll save the video another time to talk about the physiological, what's going on in the muscles when you sit in that positions, but I'll save it for another video. So if you do have tendency to sit into the couch, I want you to consider the exercises. That's the bird dog or glute bridges, and you can also find them on my YouTube channel as well. And if you want to learn more with demonstration with books, if you're a visual learner, I also wrote a book on the low back pain free program, and in the back of it, there's demonstrations that you can take a look at as well. If you're interested, it's also on Amazon. So now you know why you shouldn't do these three posture habits and how it can affect for your spinal regions. I really want you to consider this. If you want to have a longevity for your spinal health, you really got to take care of it. If you don't, you're going to keep paying the physio, keep paying the chiro to treat. That is totally unnecessary, and you can reduce the amount of visits. And it's okay to see them from time to time just to get maintenance, but just consider changing the habits will bring such tremendous help to your spinal health. If you find this video helpful, please share it with your family and friends, and don't forget to subscribe to the channel, and I hope you find it helpful, and I'll see you in the next video. Thank you.